Pleasure to come down and speak to people that about a subject I really feel passionate about. And tonight we're going to focus on, this thing does sort of fade in and fade out, doesn't it? We're going to talk about, tonight's talk, we're going to talk about preventing chronic disease, reversing it and stabilizing it. We're going to focus on obesity, arterial disease, and also diabetes. And we're going to mention why it's important for you to do this and not rely on anybody else. I'm going to give you a recommendation, which I think is the best recommendation given the best science at this point, and talk a little bit about going a little beyond health and why you should do this. I was trained as a chemical engineer, went to medical school at Georgetown, did family medicine residency, went to work for Kaiser Permanente for 30 years, saw patients, ran some of their facilities. Along the way, I was certified as a physician executive and also a patient safety officer at Intermountain Healthcare. What I do now is I give presentations to physicians in education, also lay groups. I do some writing and also do some patient care. I'm a medical director for Meals for Health, and also I work at the McDougall Clinic a couple times a year. So setting the stage, the key point that you need to walk away with from tonight's talk is that chronic diseases can be prevented, they can often be cured, and it's always better to start before you have them than waiting until you have them. And also, it's never too late if you've got them. Even if you can't cure them, you can avoid a lot of the problems and stabilize problems. So that's the message for tonight's talk. We're only going to be able to talk about 3 very common and important disorders, but it applies to a long list of them. I always like talking about moving upstream because when I was a physician at Kaiser in charge of patient education and preventive medicine, I heard Dr. Ardell speak, and he talked about the upstream-downstream story, which I think is very analogous to what's going on in the medical profession. It seems like there was a town of downstream, and many of the old-timers remember how Spartan the facilities were, how difficult it was to pull people out of the raging waters. They would lose rescuers on a regular basis. They were only able to pull a few people out, but they've responded admirably to the challenge. There's a brand new hospital right next to the water, motorboats ready to go on a minute's notice. They're able to pull everybody out of the water, and they're able to save and not lose any rescuers. It seems like they're so busy, nobody's asking how the bodies are getting there in the first place. So today we're going to start moving up. Tonight we're going to move upstream and find out how the bodies are getting in the river and what we can do about it to prevent it. And these are the deaths. These are the most common causes of death in the United States. Cardiovascular disease is number 1 and cancer is number 2. These numbers have changed. The numbers have changed recently, but the order is the same. You'll be a little bit surprised by the third thing on the list, which is medical care. Obviously, if you can prevent disease, you will not contact the medical profession as much. If you do not contact the medical profession as much, we will have less opportunity to hurt you or kill you. Okay? We're going to talk about hypertension, which is involved in strokes, diabetes, and a little bit about Alzheimer's disease. Just some definitions, because you hear this all the time and it drives me crazy. We're talking about drugs as primary and secondary preventive agents. They really aren't. Primary prevention is preventing a disease before you get it. That's sort of like staying out of the river. Secondary prevention is when you're in the river and you get out of the river. Tertiary prevention is where you're just treating complications with drugs and things like that. That's like treading water in the river, okay? Medicine has charged off. As a medical doc, as a family medicine doc, I wrote a lot of prescriptions. And we've done this very well. We've charged off into tertiary prevention, such that in 2006, 50% of people in this country take at least one drug. Over age 65, 1/4 of our citizens are on 5 or more medications. And a really scary statistic is that 25% of our children under age 20 are on a medication. So we've done this very well. The trouble with this approach is it leaves us with this sort of mopping up medical care industry, where we have patients that are on, they have a lot of medications, but they've still got their disease, basically. So here's a patient before they begins the treatment, and here's a patient 2 years later with a bag of medications. Not an uncommon finding. We are living a little longer. That's the good news. This is a recent study in 2010 by Crimmins et al. That showed that on average at age 20 and about age 65, we're living about a year longer. That's the good news. The bad news is we're living longer with at least one disease, 2 years longer with at least one disease, and we're almost 2 years less likely to be functional on some fairly basic levels. So we're living longer, but we're having lower quality of life. And worse than that, if you assess people's quality of life, actually, it's bad. And if you look at this interesting, a lot of it about pediatric obesity, but in a survey of quality of life of children between the ages of 5 and 18, the obese children had less quality of life than the children who had cancer. So these chronic diseases have a really adverse effect on individuals and their family. And it's come at a great expense. We pay $2.4 trillion, which is 17% of our GDP, on health care. And what does that get us? 37th out of 191 countries. We are first in spending, however. The next country is 50% below us. But we're not good in life expectancy, infant mortality, adult male or adult female mortality. So, in my opinion, about 80% of that's avoidable. About 90% of it's pure waste, but about 80% of it's avoidable. Part of that is the fact that we spend a lot of time treating chronic diseases we don't have to treat if we prevented it. Part of it is that because of all those errors we talked about, Don Berwick, who's sort of the expert in this area, and Brent James think that at Intermountain think that about 20 or 30% of our healthcare dollar actually goes to treating people because of our preventable illnesses and mistakes that we cause. And the last part is we just don't use our healthcare professionals very, very efficiently. So let's talk about obesity. My first pet peeve is BMI. Has anybody in the room not heard about BMI?
I don't know what it is.
It's your body mass index. And it's what people are, if your body mass index is above a certain point, they will say you're obese. If it's a certain another above, it'll be you're overweight. It's always in the news. It was actually invented by Adolphe Quetelet back in 1832. And he was trying to describe the differences between people. And basically, it's your weight over your height squared. You sort of need a computer to compute that, so you've got to go to your doctor to get it done. So it sort of develops dependency on us. And Ansel Keys in 1972 wrote an article, and he revived the interest in BMI. But in his article, he said, this should not be used for individuals. This should be used only for populations. But we violate this rule every time. And as a matter of fact, one of the more recent articles looked at, if you look at just BMI, it actually misses about 50% of adult obesity. It's especially poor in the elderly and in men, and it misclassifies about 30% of men who are very muscular as being obese, and it misses about 12% of women because they're low in body weight, but they're high in body fat. So it's not a very accurate measure. Obesity has become a major problem in this country. In 1985, we started gathering data on this. Now, here again, this is population data, so we can use BMI. And this is obesity. Body mass index is greater than 30. And you can see the biggest states with the highest amount are down in the 10 to 14% range. If you fast forward to about 1995, all of a sudden you find an awful lot of states in the 15 to 19% range. You jump forward another 10 years, and all of a sudden you've got states not only in the 25 to 29% range, but you've got states down here in the Deep South. We've got Louisiana and Alabama and West Virginia, greater than 30% obese. Colorado and a few other states are still hanging in here, but as you're going to see, in 2009, which is the latest data I have, it just keeps getting worse. So you've got greater than 30%. We still got Colorado hanging in there at about 15 to 19%. But that's the state. So if you look at an aggregate, about 70% of U.S. adults are now overweight. Dan Ferraro suggests in his cartoon that we ought to redo the restroom signs for the new America to more accurately reflect how we're doing. We've got a little surgery going on here in the video world. Oh, that's great.
I like it.
Just to get the cut-ups there.
So if you look at the actual food consumption, since 1970, the U.S. has consumed on average about 500 calories more per day. No, 500 calories per day more on average for U.S. citizens. Now, if you look at where this is coming from, actually look at the food. This is sweeteners.
Which color?
Okay, here we go. Total sweeteners are 19% have gone up. Now, sugar, you hear a lot of people say sugar's the answer. You just got to get sugar out. Well, sugar's part of the problem. And as you're going to see a little later, one of the biggest problems is we've actually gone down in regular beet and cane sugar, but we've gone up in corn syrup and fructose. And fructose is a problem because, and we're going to explain this to you a little bit later as to why it's a problem. If you look at total fat really took off around 1997, 98. It went up 61%. Animal fat actually went down 17%, but vegetable fat went up 91%. If you look at added fats we actually add to our food, it went up 220%. Shortening was 64%. That usually added to cooked goods and things like that. And also salad oils were way up. This is the main source of oils in women, actually, is salad dressings. Cheese has gone up markedly. American cheese up a little bit. Other cheeses up 428%, led by mozzarella and pizzas. Red meat consumption is actually down. I had a lot of patients that would come in after they'd been seen by the cardiologist and say, "Doc, I'm not eating any red meat, but I am eating chicken and turkey, up 42 pounds. We're getting to fish next. So down 30 with the red meat, up 42 with the white meats, and we've added another 4 pounds in seafood. Total seafood, mainly fresh and frozen, cans down a bit. So if you actually look at the standard American diet over the last 40 years, the only thing that has gone down is vegetables. It started a little uptick in the 1990s, but it's gone down since then. Fruits look pretty good here at plus 23%, but a lot of that's dried fruits. And dried fruits are very calorically dense. We're going to talk about that in a minute. All the rest are going up. So your key concepts for obesity that I want you to walk away from this talk with are the fact that satiety, which is your hunger mechanism, don't mess with it. You are hardwired not to be hungry. If you try and go on a calorically restricted diet, you will fail. Only 4% are successful at the end of 2 years. Your body's hormones and everything are set up when you're hungry. What happens is one of your hormones that drives your appetite goes down, so you get hungrier, and your peripheral metabolism slows up. It's exactly what you don't want to have happen. We're going to talk about that. And here again, what gives you the factors of fullness are water, fiber, bulk, and nutrients. And so what we're going to, the other concept, so that's satiety, don't mess with your hunger mechanism, and also caloric density, or how many calories per pound. In the medical literature, it's actually calories per gram, but people don't understand what grams are. When I was in junior high school a long time ago, we were going to convert to the metric system. So we haven't gotten there yet, so we're still talking about calories per pound. But what happens to a regular food is you decrease the water, you take the fiber out, you refine the ingredients, or you decrease the nutrients, you make it more calorically dense, more calories per pound. So that if you actually look at this is probably one of the more important slides tonight. Vegetables on average are about 100 calories per pound. At my height and weight, I need about 2,500 calories, maybe 3,000 to maintain my body weight. I would have to eat 25 or 30 pounds of vegetables a day. I couldn't do that if somebody put a gun to my head. Fruits are 300 calories. That'd be about 8 or 9 pounds of fruits. That'd be hard enough as it is. We're getting a little bit better when you get to what John McDougall calls the starches, or the unrefined or complex carbohydrates, at about 500 calories per pound. That's your potatoes, your grains, your sweet potatoes, your tubers. You get up into the beans, they're about 600. Your meats, your fatty protein sources are about 1,000. Refined carbohydrates, sugar, and things like that are about 1,400. Junk foods, 2,300. Cheeses are somewhere in between. Nuts and seeds are 2,800. And oils are 4,000. All oils, including motor oil. But nobody drinks motor oil, right? So all oils are 4,000 calories per pound. Now, if you want to lose fat, all you have to do is move up the scale. When I was practicing, I have a lot of patients that would come to me and they'd be overweight and they'd have bad arthritis in their knees, and they would say, my orthopedic surgeon wants to give me a new knee but won't operate on me because I can't lose weight, and I can't lose weight because I can't exercise, right? What Jeff Novick did was he actually looked at the amount of exercise with this, and actually if you maintain from here up if this is what you eat mainly, you can actually lose weight on a couch with a remote. And we'll show you that in a minute. So just to pictorially look at this and see what it looks like in pictures, if we look at 100 calories, this is a 1 1/4 cup of vegan lentil soup versus 2 chick nuggets. Which do you think would be more filling? It's not a trick question. How about 200 calories? Some French fries, 6 slices of honeydew. Want to go to 450? 4 ounces of gummy bears versus 2 pounds of fresh pineapple. Or how about 800 calories? A cup of cashews versus 6 medium-sized baked potatoes with salsa. Which would be more filling? So if you look at exercise, you maintain about 500 or less, 400 or less, and you're sedentary, you're going to lose weight. If you're fairly active, depending on your level of activity, you can go 400 to 800 on the calorie density scale. Elite athletes are 800 to 1,300, and you're going to gain weight regardless if you're eating a lot of stuff above 1,300 calories per pound. Now, the reason this is important is we've got a lot of people running around looking fairly thin that think they're in good condition. And then they have happened what Jim Fix had happened to him, which was he was running, and he's the guy that started the running, and he just dropped dead of a heart attack. He was still eating cheeseburgers. Exercise is good, and we're going to get to that in a minute, but it's not the only answer. So as I was mentioning before, leptin is produced by your fat cells, and when you actually, after several days on a fast or less than caloric intake that you need, your leptin levels fall down, which your body interprets as starvation, so it actually drops your peripheral metabolism and increases your hunger. Likewise, when you eat low-fat foods or you exercise, it has the opposite effect. It actually suppresses your appetite and actually increases your peripheral metabolism. And that's the way you want to go. The rule of 10 is basically take your ideal body weight, multiply by 10. So let's say I want to be 170 pounds in my dreams, maybe. I used to be when I was in college. 170 times 10 is 1,700. If I started eating less than 1,700 calories a day, my leptin system would start fighting back. So I want to make sure I consume at least that many calories a day. There are some tricks in losing weight called preloading, and they've done studies on this. Whereas if you eat a small salad or a large salad before you eat your regular meal, you'll actually consume less calories in your regular meal overall when you add them all together. If you take a low-fat vegetable soup, like that vegan lentil soup, you'll actually consume 20% less calories. On the other hand, if you go to a standard American salad bar with high-fat salad dressings and cheese and things like that, you're actually going to consume more calories. And if you drink fruit juices, 100 calories of fruit juice, you actually consume more calories. So the take-home message with the juice study is don't drink your calories. Here's 2 participants in the Bruce and Hillary. Actually, Hillary was a Geico employee, and this is a PCRM study that was done. And she entered the program, and he went along for the ride. And every week they would get together with the participants and have a support group teaching people how to cook and eat low-fat vegan. And 1 year later, this is after they completed their first half marathon, and Hillary had actually lost 85 pounds, and Bruce had lost almost 100 pounds, just going on a low-fat vegan diet, about 1 to 2 pounds a week on average. So, obesity is not genetics. In the last 40 years, when we've gotten fat in this country, the genes in this country have not changed one bit. So it's not the genetics, it's the environment, okay? For those, has anybody ever seen Michelangelo's David? I mean, I was riding with 3 friends over in Italy, and we actually saw this guy. This guy's huge, okay? He's up on this pedestal, and he makes him look even taller, but he's about 20 feet high. So this is the rendition of what would happen if they dropped him into the American food environment for 6 months. I'm not sure how scientifically accurate that is, but it does drive home the point. And the point is that we are designed for an environment of scarcity. When we get dropped in an environment that has got a lot of sugar, fats, and salt, and there's a lot of lack of information being given to you as to about what you're eating, you get 3 obese species out of over 5,000 mammalian species. So what are the 3? Us, dogs, and cats. Why do dogs and cats get fat? They're around us, right? You can take a wild rat and put him in a cage with no exercise and feed him wild rat types food, and she won't get fat. On the other hand, if you put him in a cage, even if you give him an exercise wheel and you feed him the standard American diet, they're liable to get fat. It's about environment. And it's important that you understand what is going on out there in your food. So, there's been a lot of misleading information on obesity. The government's food pyramid is one of them. Here's Bizarro's cartoon. The government food pyramid must be working. More Americans than ever are looking like pyramids. So some of the myths out there are you should count calories, that you actually need to go on a diet, that carbs are bad, and that exercise is the answer. Based on the best science, we need a new pyramid. This is the PCRM plate, which looks very similar to the USDA's new food plate. Of course, they've got milk out here. But this is grains or starches, vegetables, beans, and fruits. So you need to eat when you're hungry, the ad libitum diet. We'll talk about that a little later. Look at the calorie density. Exercise is helpful. And just move to a new pyramid. Don't try and diet. Don't try and restrict calories. Just eat a different food intake. I have to put a comment on childhood obesity because it's in the press so much, and it's a tragedy. That's for it. Here's Bizarro's lunch lady who says, and remember kids, not only is milk a fattening health hazard, but when you're drinking milk, it means a sad, lonely calf somewhere isn't. Actually, if it's a male calf, it's in a veal crate, and if it's a female calf, it's on its way to becoming milked and have a shortened lifespan. But children do not generally decide on menus, shop for food, prepare food, drive themselves to fast food restaurants, at least until they're teenagers, have the ability to make well-informed choices, and beyond that, they're being surrounded by adults who aren't setting a good example of what a good diet is. So childhood obesity is an adult problem. I want to hear a story on that somewhere that actually just says that. Not to be outdone by guys like me, who's a medical doc who writes lots of prescriptions, the surgeons are going along for the ride too. Here's the gastric bypass surgery, which I couldn't in good conscience recommend to any of my patients, knowing what I know now. And number two, I think the people that do gastric bypass surgery, and they're talking about doing it in children, that's a criminal offense. I think it's unethical to do it in adults, except in very isolated instances, but it actually should be criminalized for children. The short-term successes on paper look pretty good. And if you look at the growth of this since 1998, look how many we're doing now. This is like $20,000 a case. We do not have long-term costs reported. We don't have long-term benefits reported. So the surgeons are jumping on this bandwagon too, and you're seeing this being advocated as a treatment for type 2 diabetes. And after we finish talking about diabetes, you're going to see how crazy that idea is. So let's talk about arterial disease. Now, everybody knows about blockages, stents, and bypasses. Blockage is part of it, but there's a constriction because the actual muscle around the artery constricts due to the inflammation. You get inflammation at the lining of the walls. It's what causes the blockage, and this affects all the arteries in your body. So here's a picture, you've got sort of blockages, and you've got little lipids, the cholesterol gets in there and causes inflammation, and you get sort of a very irritated lining of a wall. Now, we've known for a long time that coronary artery disease is tied to lifestyle. This is the incidence of coronary artery disease in Norway. And you can see when the Germans invaded and took away all their meat and eggs and stuff and sent them to their troops and took away the gasoline, they had to start walking. You can see what happens. Of course, the other alternative were the Germans were the greatest public health people, educators that ever lived. Dr. Esselstyn thinks it's probably the former, not the latter. I would have to agree with him. So we spent a long time trying to figure this out because it's killing more people than anything else in the country. And we came across an interesting information that a lot of coronary events occur in vessels that are not blocked. It isn't the blockage that causes the problem. It's the inflammation along the lining. That's why stents and bypass surgeries do not prevent heart attacks. They just relieve the symptoms from the inadequate flow. About 1990, actually 1986, they named nitrous oxide, which is a substance that's made in your arterial wall linings that causes dilation and makes your vessels healthy. We finally discovered it. So not only does it dilate your vessels, it stops the platelets from adhering to the things that cause clots, it blocks inflammation, and it keeps the smooth muscles from proliferating and getting thicker. So it's a very important substance. And your body tries to protect itself because you make a normal, ADMA is a normal metabolic byproduct, and it actually keeps the nitrous oxide from being formed. But your body has an enzyme to get rid of this stuff, so your nitrous oxide system works. What we now know is most of the risk factors associated with cardiac disease, high blood sugar, bad insulin, smoking, cholesterol, inflammatory products the body makes, infections, all interfere with this enzyme. So we're starting to figure this stuff out between the blockages and the cholesterol and the inflammation. And now we can even study how this works. Dr. Vogel in 1997 published the first study where we take a blood pressure cuff, blow it up on your arm above the top above your systolic pressure so you don't have any flow to your hands for 5 minutes. We put a little ultrasound transducer over the brachial artery downstream, we release it, and how fast really healthy arteries expand very quickly after that. But if it doesn't expand as well, it means something's wrong with your artery. And he's been able to demonstrate that even just taking like 2 or 3 tablespoons of olive oil affects the dilation of those arteries. So we now have a way to indirectly, without sticking people with needles and running all sorts of tests, to test this out. The P-Day study, which was done in 1999, looked at people who had died between the ages of 15 and 35 of homicide, suicide, or trauma, like motor vehicle accidents. And they found in 15 to 19-year-olds that the aorta, which is the big artery coming down the back, out of the heart, going down near your spinal cord, there were 100% lesions in those people if they had been on the standard American diet. 7% were starting to get raised. 50% had lesions in the right coronary artery. The reason they looked at that one, it's just easier to do an autopsy. 18% were raised. So even in the teenage years, evidence of arterial disease is already there. When they went out and looked at they did this across, but to look at the other end, there was 60% raised, up 74% in the right coronary artery, and 43% raised. So unless you've been on a low-fat, plant-based diet, whole food plant-based diet since you were born, everybody in this room's got arterial disease, myself included, because I've been vegan now for 6 years. I've been reversing it and trying to prepare the damage that was done up for the first 58 years, although the last 15 was a vegetarian, so I'm doing something a little better there. So that's the good news. I mean, this is the bad news. The good news is this stuff can be reversed. Dr. Ornish in 1992 and 93 came up with a paper, and followed shortly by Dr. Esselstyn's paper, that showed that people that went on a low-fat, plant-based diet actually reversed the blockages. By 82% reversed the blockages and opened their arteries up by 4% on average, which is amazing. But the more amazing thing, especially in Esselstyn's group, was the people that really followed the diet did not have another heart attack or coronary event. People who they thought were going to be dead and would have been dead in a couple years, all of a sudden had no more worries about arterial disease. So this is a case study. This is Joe Crow. He's actually a surgeon at the Cleveland Clinic. He was 44. He had no family history of coronary artery disease. He was not overweight. He was not a smoker. He exercised. He had no diabetes or hypertension. His total cholesterol wasn't that bad, and his low density wasn't all that bad either. He started having chest pain on exertion. So he went and he was studied. And you're going to see his arteriogram in a minute. And he had a blockage in one of his arteries. But it was in a location where they couldn't do bypass because the vessel was too small, and they couldn't do a stent on this vessel because it would have killed him on the table probably. So they didn't. So he went to Dr. Esselstyn and went on the Esselstyn diet, and you'll see the results here. So this is his distal left anterior descending artery, which is one of the major arteries for the heart muscle. You can see how narrow it is. This is at 2 years later. The reason they did this repeat angiogram 2 years later was that he was developing chest pain again at work, and they were afraid that it might have been the arterial disease, so they wanted to check to make sure it had not progressed. And in fact, it had reversed. And his chest pain had nothing to do, it was musculoskeletal. It had nothing to do with actual coronary artery disease. And for people who are interested, Dr. Esselstyn's book, Prevent and Reverse Heart Disease, is a good one for people with arterial disease to read. So I told you about the Ornish and Esselstyn study that showed you can actually reverse the blockage in about a year. But But the amazing thing is when you make your nitrous oxide system healthy, and you can do that relatively quickly, that you can open up the blood flow to vessels fairly quickly. These are nuclear radiotide, where they actually put you under the counters in nuclear medicine. They inject some material, and they actually check the blood flow to the heart. And this is before, and this is after. And you can see how much better the blood flow is here compared to here. And this is a different view. This is from the front, this is from the top. And you can see how there's much better blood flow all the way around that wasn't here. And this is just in 3 weeks. And we've done studies on patients with angina, which is exertional chest pain, and within 1 week of being on a low-fat, plant-based diet, their chest pain's gone. Now, sometimes you have to augment those with some statins temporarily, but usually you don't. So let's digress a little bit into the fats. You've got natural fats in the diet. There are saturated fats, which are the animal fats, and tropical fats. Those tend to raise your cholesterol and your low-density cholesterol, your low-density or lousy cholesterol, and your total. Monounsaturated fats, which are semi-solid, such as nuts, avocados, olive, and canola oil, they have a minimum effect. And your polyunsaturated. The reason we talk about these is because your body can make all the fats you need in your body. It needs 2 building blocks that it doesn't normally have. And those are called omega-3s and omega-6s. And you've heard about the omega-3s, of course. The omega-3s naturally occur in dark leaf green vegetables like kale and collard greens, walnuts, flax, algae. Omega-6s occur in cottonseed, corn, safflower, and sun oils, and other things you'll see in a minute. These are the processed fats in our diet. We're eliminating the trans fats now because they can not only increase heart disease, but also increase cancer and diabetes. The food industry started to come out with some new wrinkles called interesterified fats, but the preliminary data looked good, and they're now taking those out. So I put this slide up just to show that all oils have saturated fat. Saturated, the polyunsaturated are the omega-3 and omega-6s, and the monounsaturated. And if you look over here, canola oil is probably the healthiest as far as saturated. And flaxseed, sunflower have the most omega-3s and omega-6s. But the other interesting thing is coconut and palm kernel. Now, you can be a vegan, you can go on a plant-based diet and be fat. Because there's a lot of fats in the plant world. Nuts have a lot of fats. And you can eat a lot of vegan ice cream, which I love, by the way, but I don't very much. And you'll find that it has what? Coconut oil and palm kernel oil in it. Those oils actually have more saturated fat than butter. So this is where I have to delve you into a little biochemistry, unfortunately. To actually, you take the omega-3s and the omega-6s into your body, and they're made into stuff that your body needs. It needs some anti-inflammatory, anti-clotting stuff, and it needs some inflammatory clotting stuff. Unfortunately, those things go through the same enzyme systems to make these things. And ideally, we want to have about a 2 to 3 to 1 ratio here, so everything gets made and proper. But right now, we're running more like anywhere from 7 to 40 to 1 here. So you can imagine if you've got a lot of this stuff and a little of this stuff, and they're trying to get through the same sort of gate there, you're going to get less of this and a lot of this. This is why aspirin works after heart attacks, because it tends to block the arachidonic acid, which also you find in a lot of meats. So this is where the recommendation comes to eat fish, because fish have omega-3s, EPA, and DHA in them. So other sources of omega-6 are poultry, eggs, grains, and meat. Also has arachidonic acid in it, so you want to minimize this. So here's the recommendation. You're eating fish to get the omega-3s, right? Fish has got arsenic, mercury, dioxin-like compounds, which are carcinogenic, insecticides, pharmaceuticals, fat, saturated fat, and cholesterol. You get all that with your omega-3. You can go with fish oil, which has also been shown to have no effect on the body, no effect with heart disease, but also has all the bad stuff in it. Doesn't have as much fat and saturated fat and cholesterol. But you know, the problem with this is the fish don't make it. The fish get it from algae. So you're better off just eliminating the middle person. Here are the sharks looking at the swimmer saying, they're full of the fish that used to be swimming around out here, so if we eat them, we're still getting the right nutrients, right? Same nutrients, right? That's the same logic when you're eating fish to get the omega-3s, okay? If I recommend to one of my patients that they have an omega-3 supplement, then they get a vegan capsule that has that's based on golden algae. It doesn't have any of the bad stuff in it. It just has the DHA and EPA that you need. So, one interesting thing about the way we're designed, if you go far enough upstream and design something properly or live within the design of the system you have, you get lots of benefits. For instance, if you design a building that is so energy efficient that you don't need an air conditioning or heating system, you don't have to pay for its installation, you don't have to fix it later, and you do not have to pay for the heat and air conditioning bills. Well, going far enough upstream in humans, as you're going to see, we're designed actually as plant eaters. So you do that, you get benefits across a lot of diseases. And arteries are very prevalent in the body. And you're going to see a couple pictures here to drive this home. But you will see improvements in high blood pressure, strokes, degenerative disc disease, sexual dysfunction, both males and women, by the way, men and women, Alzheimer's and macular degeneration, plus others. So beef, it's what's for dinner. Stroke, it's what's for later. So we're going to talk briefly about hypertension here. And I mentioned design. Humans are basically hindgut fermenters. We're very similar to elephants and horses in this respect. We used to think that our colons at the end of our intestine actually didn't do much. But what we found is that they actually break down the fiber, and actually we get nutrients from our colon. That's where our GI contents spend about 18, 24 hours a day. So in high blood pressure, it's been shown that people who go on a plant-based diet have much lower blood pressures. In working at the McDougall Clinic, I've been very impressed, and you'll see an example of a guy a little later on who really lowered his blood pressure in just about 6 or 7 days once you start eating correctly. So just to drive this home, you get your blood pressure taken. There are two numbers, right? First number is your systolic pressure. Second number is your diastolic pressure. The way to look at that is you've got a pump, and it fills up with blood, and it pushes that out. And if you take a transducer and put it in your artery, your pressure goes up. The top number is your systolic pressure, and then as your heart is loading and firing, it drops to your lower number. Well, you spend more time loading than firing. So your lower number is actually more, you spend more time at your lower number, so your average pressure is a little closer to your lower number, so it's a little bit more critical, but they're both important. And the top number reflects how elastic your large blood vessels are. You can imagine when you're small and you're young and the heart beats and those vessels are nice and flexible and they sort of give way, that top number doesn't go up as high. But as you get older and those things get a little bit more rigid, up goes the top number. That's systolic hypertension. But with all the resistance in the small blood vessels, that's where you get your diastolic pressure. So recent studies showed that people who have narrow discs, which I used to take a lot of x-rays on people with back pain and say, oh, that's just wear and tear. Actually, it's a marker for cardiovascular disease. Because what happens to your disc spaces in here between your vertebrae is they don't have direct blood supply. They get the blood by diffusion from the vertebral bodies that are fed off these arteries. And what they found in some Finnish autopsy studies is that people who have narrow discs, who tend to have collapsed vertebrae, also nonspecific back pain, even in their 30s, tend to have more clogged arteries here. And if you look at this figure, this is actually a look at your arterial system, the large vessels here, but look at all the little capillaries that are feeding the blood to your arteries. All those things are, if you eat poorly, all those things are affected adversely if the nitrous oxide system is messed up. So you can just imagine, you've got about 65 or 70,000 miles of arteries in your body. So the arterial blood supply system to your body is very important. And you need to eat well to help maintain that. Exercise also helps. We'll talk about that in a little bit. We're not sure why plant-based diet helps blood pressure so much, but it looks like when you eat more fruits and vegetables, you get more potassium, magnesium, antioxidants, and soy. All these things have been shown to lower blood pressure. You also get less sodium, more fiber, you tend to lose weight, and your body weight tends to go down. And that always tends to decrease your blood pressure. I don't talk about medications. I give medications. I'm a physician, so I write prescriptions. Not as many as I used to. But I like to talk about statins because they're in such use. They took patients who actually had no symptoms. These are people like I'd have on a statin. They would come into my office and say, how do you feel? And I feel fine. I'd check their CPK level, which is an enzyme to check for muscle inflammation. Because we don't like to see those numbers going up because you can have a very bad consequence. And they would be normal. I'd say you're doing fine. But they did a study on 14 patients with that sort of history and lab findings, and they found that 10 of the 14 actually had cellular damage at the cellular level. And another study showed that in elderly patients on statins, they have a higher fall risk. So it looks like about 95% of people who are currently on statins would need to be on statins if they would eat a good, well-designed plant-based diet.
What are statins?
Statins are like lovastatin, drugs for cholesterol. We also give niacin. Good question, thank you. And I also am glad you're hearing.
Yeah.
Because you must be hearing or you wouldn't have asked such a good question. So here again, the surgeons are taking advantage of all this. In 2006, we did 1.3 million angioplasties, which are when they go in and put the little stents in. You may know people who've had stents or bypass angioplasties. We did almost 500,000 bypass surgeries. These cost about $50,000 a pop. These are about $100,000 a pop. There's your mortality rates. So basically, for over $100 billion, we killed 27,000 people to relieve symptoms that they could have relieved if they'd gone on a plant-based diet. And didn't reduce their risk of having heart attacks, as they would have on the diet. 10% of our Medicare budget is now based on this stuff. So, I think the medical profession needs to design well-informed mechanisms to tell people this sort of information. And it may be that somebody get all this laid out and they say, I still want you to cut on me, doc. And then we're going to talk about who needs to pay for it. Because I'm not sure all of us need to foot the bill for something for $100,000 for something somebody could fix for maybe $5,000 or $10,000. But just to let you know, so here's Bizarro again. Welcome to Texas. Come for the barbecue. Stay for the angioplasty. Okay, diabetes type 2. Everybody knows what diabetes is. High sugars, right? High glucose in your blood. Okay, here's where you get a little bit more biochemistry. Glucose. This is a glucose molecule. Each one of those little corners here is a carbon molecule, okay? This is glucose. This is fructose. They're not the same. Your body burns this in every cell of its body. As a matter of fact, this almost is exclusively what your brain burns. Only one organ in the body can handle fructose. Anybody want to guess? Liver. Liver. Liver is designed to detoxify your body. Sucrose, which is table sugar, is actually one of these and one of those. This is refined carbohydrates. These are simple carbohydrates. You eat them, they get into the body quickly. You love them because they're sweet. As a matter of fact, if you look at the sweetness index, glucose is 75 on the scale. Sucrose is 100. Look where fructose is, 173. You wonder why they're putting a lot of this stuff in your food so you can eat more of it? As a matter of fact, back in the 80s when we went on the low-fat craze, the food industry had two options. Make foods with lower fat or add sugar. What do you think they did? They added sugar, which meant it was lowered relatively in fat but had the same amount as fat, but people liked it more. The story Jeff Novick tells, which I always find humorous, is, the lady's going out to the store and husband's sitting in front of the TV with the remote and says, hey, give me my graham crackers. So she goes to the store and here's this, low-fat graham crackers. Wow, healthier. Brings them home. Says, what is this stuff, Low fat. Oh, no, I want my regular graham cracker. Oh, try it, So he tastes it. It's the same graham cracker with more sugar in it. He loves it, so he eats the whole package. If you use Pam, little spray Pam, or spray olive oil or canola oil, it's a good product, but it is 100% fat. But if you look at the label, it says it's no fat in it. If you look at the label, there is no fat in it. In a 100% fat product. Now, how do they get away with that? Well, look at the number of servings. There's like 500 servings. If they raise the servings up high enough to get the amount of fat to lower than 0.5 milligrams %, they can round down to zero legally. I mean, 500, it's like, you got to be quick with your hands to put that serving out. So there's lots of misinformation. And Jeff Novick, in addition to doing a great calorie density DVD, which you can get for $20, also does a very humorous one on reading labels. And I left my card in the back along with the PCR material. If you go to my website and look at resources for everybody, you can actually see some of the things I recommend as far as the books and the tapes. So, Glucose is our primary energy source. It's stored as glycogen, which is long strains of glucose in the liver and the muscle. The liver metabolizes it both to cholesterol and glycogen, and the excess fat is stored in fat cells. It stimulates insulin release, and it depresses your appetite. Glucose is a good thing. It's good. Glucose, good. Okay? Fructose, however, you've got to be a little cautious with, because it is metabolized only by the liver. It's not stored. While it's getting through the liver, it makes uric acid, which causes gout. It also raises high blood pressure, has been shown in recent studies. It makes low cholesterol. It makes aldehydes in your liver, which are toxins. And it makes free fatty acids, which get out in the body. And actually, as you're going to see, is the cause for diabetes. Because diabetes is basically a fat problem, not a sugar problem. It also causes inflammation in the liver. Leading cause of cirrhosis right now is fatty liver from fructose and food. So, this just says starches are good. John McDougall, a friend of mine, just wrote a nice book called The Starch Solution. Just came out on May 8th, actually. I recommend it. It's a good book. Sort of tries to lay to rest this confusion about simple sugars and starches. Starches are those 500 calories per pound that I talked about, foods, complex carbs. Fiber looks very similar. It's just that it has slightly different connections, so we can't digest fiber, but the bacteria in our colon can. So, the key concept for diabetes tonight is it's a sugar processing problem that is caused by fats. And the fructose contributes a little bit of that because it's actually the fructose going through the liver that creates about 30% of your fructose goes to fats, free fatty acids. So if you're a type 2 diabetic and you pick up Neil Barnard's book, they're going to talk to you about a low-fat vegan diet, but they're also going to take your vegetable fats and lower them. In other words, they're going to keep you away from oils, olive oil, canola oil, and things like that if you have type 2 diabetes. If you read the book, I want to emphasize that you've got to work with your physicians on doing this. This is a medical information lecture, not a medical prescribing lecture, okay? Because you can, if you're on the glipizide, sulfonylurea type drugs, you can actually get very low blood sugars. And we'll talk about that in a minute. So, this is a slide. You've got the insulin, which is the drug, is the hormone made by your pancreas. It hits this receptor, which stimulates this little receptor over here that actually allows the glucose to get in the cells. And the fat in the blood interferes with the insulin. As a matter of fact, it's probably unlikely, but if anybody here knows somebody with polycystic ovarian syndrome, a low-fat vegan diet is a great way to treat that because they have a lot of insulin resistance because of the fat in their diet. It also, by getting fat in the cells, it actually interferes with the genes that run these little things called the mitochondria, and those are little engines in your cells that actually burn your sugar. So the fats cause insulin not to work as well, which means the sugar doesn't get in, and when it gets in, because of the genes that's messing up by the fats, the mitochondria don't burn. So you get sugar buildup in your blood. Now, why do you have to eliminate animal products if you've got diabetes? Well, this gives you an idea. Cheddar cheese is 72% fat. All the way down to white tuna, it's 16% fat. 1% skim milk is 21% fat. Then you get into broccoli, beans, rice, and sweet potatoes. You can see how low fat those are. So potatoes are actually good foods. Now, if you cut them up into small pieces and drop them into a fat fryer and turn them into a 50 or 70% fat food, then you've just moved them right up the scale to here, and you got problems on your hands. Okay? Okay, here's Ben Exkosian. He's a poster child for Whole Foods. I had the honor of taking care of Ben a little over a year ago at the McDougall's Whole Food program. This is how he came in. This is 10 months later at 80 pounds off. The amazing thing about Ben, 45-year-old guy, came in with type 2 diabetes, high blood pressure, and hyperlipidemia. When he walked in to see me at the McDougall Clinic, he weighed 313 pounds. His blood sugar was 159, which was diabetic. Cholesterol was up. Blood pressure was borderline, and he was on two different medicines for his diabetes. One medicine, high dose for his blood pressure. He was taking a medication, here's your statins for your cholesterol. And he was taking 4 Tums right before he went to bed because his heartburn was so bad. I told Ben he was going to eat the McDougall diet, and he had to stop all this medicine except his Lipitor and only take his Tums as he needed them. But he felt a little bit bad about that. He needed to hang on to some of the metformin, so he managed to take half a tablet for a couple days before his sugar started dropping down pretty low, so he stopped that. After 8 days, he had lost 3 pounds. His blood sugars were 30 points lower on no medication. His cholesterol had dropped 60 points. His blood pressures were the same, but without the blood pressure medicine. His reflux stopped 2 days into the program. He didn't take another tum. And his energy level on day 3 went through the roof. Well, a lot of people find when they go through the Live-In McDougall program is the first day or two they're feeling a little sluggish, but on day 3, whoom, they get this surge of energy and they start feeling great. We give them a slip when they leave, and 4 months later his fasting sugar had dropped from 129, which is just barely diabetic, to just the bottom, almost normal. His cholesterol, because we took him off his Lipitor. The reason we keep people on their Lipitor in the live-in is just so they can see how much their cholesterol drops just based on diet. And then we pull him off their Lipitor when he leaves. So his cholesterol was actually, his low-density cholesterol, or his total cholesterol, was where it was when he went out on the Lipitor. So he had no medications at that point. Now, if you go to my website and you find Ben's case study, he's got a little video that explains from his perspective what he went through. The last slide I want to show you on diabetes is an actual remarkable study. This is the sort of studies that we really need to do more of in medicine. You got to picture me. I'm practicing at Kaiser Permanente. I was there for 30 years. Great organization, a lot of potential, liked working there, gave me a good living. I love my patients. I saw many of them for 30 years. It was only in the last 3 years after I read the China study and then heard Neil Barnard talk about his book that I started using Neil Barnard's book on my type 2 diabetics and started curing them. And my fellow doctors started asking me to give talks on this stuff, so I started giving talks on it. And 6 years later, I'm doing talks all over the place. But I come across this study. So I'm working in Kaiser Permanente. It's supposed to be a good preventive healthcare system, right? And 12 years earlier, this study comes out, and I ask myself, how do I not know about this? Here's 21 patients who had adult onset diabetes for 12 years, and they had painful distal neuropathy. In other words, their nerves hurt from about their mid-calves down just from their diabetes. They'd had it for 3.5 years. They put them into the Weimar Clinic, which is an Adventist program up in Weimar, which is right above Auburn, and put them on a slightly restricted calorie diet, low-fat vegan, no refined sugars, meat substitutes, or free fats, 30 minutes a day, or 2 miles, whichever they could do. Of those 21 patients, 17 people had complete relief of their painful distal neuropathy by day 16. They had reversed their peripheral neuropathy. I didn't think that was possible. These were people that I kept giving Elavil and Tegretol to try and control their symptoms. I mean, if I had known about that study, I would have at least told them there was another thing they could have done.
You're talking about China study? You're talking about the China study?
No, this is a study by Crane and Sample, 1994, a single study. In addition, remember we talked about doing things upstream the correct way. You get lots of benefits downstream. In addition to complete relief, they had lost 10 pounds. Triglycerides were down, cholesterols were down, blood pressures were down. 80% of them were off their blood pressure medicines. Their fasting glucoses were down. Now, people often say, well, people can't stick on this diet. Well, 71% of people were still on this program 4 years later. The number was actually, should have been a little higher, but 1 or 2 of them had died. So they weren't counted in those numbers. Yes?
All the books or the computer will say, or the internet will say that neuropathy is irreversible.
I know it. And, you know, the problem is there aren't a lot of studies like this right now, but there is one. And, you know, of course, there are different types of neuropathy. This is diabetic neuropathy. But, you know, there's arsenic and mercury in your animal products, especially your fish. Mercury is a neurotoxin. Arsenic is a neurotoxin. And if you've got neuropathy, Parkinson's has been associated with dairy and insecticide exposure. I mean, the information is there. It's just isolated and nobody's making money on it. So we need to do more studies on this. So, why it's up to you? Well, the message is old. It changed a little bit. They've got a little bit more sophisticated. This is about a 1950 advertisement telling you that milk is good for you. And then here's your milk does the body good and got milk spiffed up a little bit more for the more contemporary group. But it's wrong and it's dangerous. You need to get the facts about your food. Some of these meat, sugar, simple sugar, and dairy products are addicting, and they contain a lot of bad chemicals. They also have no antioxidants and no fiber. So here's another cartoon, why they created the word cheese. So a lady asking if you would like congealed bovine mammary secretions with that. The cheese industry actually has you, as consumers, broken up into market segments, as most businesses do. 20% of you are known as cheese cravers. These are people that put cheese directly out of the package onto their food. 20% are cheese enhancers. They put cheese on everything. I mean, I've talked to patients, they say, oh, I can do that, I can give up the meat, doc, but not the cheese. I've got to have the cheese, right? Well, this isn't about weak will. Casein, which is the main protein in dairy, is broken down into 8 casomorphins, which are narcotic-like substances in your gut and absorbed into the human body. So it's about addiction. This is about addiction. Hormones in milk. Now, you can get organic milk, and you can get milk that they haven't given things to the cows. However, they have genetically improved cows now so that they're able to keep pregnant for almost 310 days out of the year. When women are pregnant, and the women in the room know this, you have a lot of estrogen running around your body. And that means you've got a lot of, if you are pregnant and being nursed at the same time, the milk's got a lot of natural estrogen in it. To the extent that if you take an 8-year-old girl and you give her 2 glasses of cow's milk, you're giving her as much estrogen as she's making in her body for an entire day. And you wonder why we have girls going through puberty earlier. It's associated with meat and dairy. Men who wouldn't look at a glass of soy milk because it's got phytoestrogens in it, none of which have ever been shown to have an adverse effect on men, will drink milk as a recovery drink. And it's been shown that men, if they drink 2 glasses of cow's milk, within 1 or 2 hours drop their male hormone level and increase their female hormone level. Great recovery drink. Cheese is your leading source of aluminum in your diet. Why does cheese have aluminum? They've added it because of sliceability and meltability. Carcinogens. Dioxin is the most carcinogenic substance known to man. Comes out of burning plastics. Any plastics you burn gets in the atmosphere, settles on the grass, gets in the food supply. Less than 120 femtograms per day is the safe level. 120. This is the FDA's safe level for dioxins. Haagen-Dazs ice cream, 49,000 femtograms per scoop. Pizza Hut pizza, 95,000 a slice. This stuff's got a 1 to 7 year half-life in the human body. We don't even know what it is in normal humans because these are industrial. Does the body good? To milk doesn't do the body good. To milk is harmful. To milk is harmful and has poisons. So here's a poor guy who didn't listen to his wife. I warned you about the hormones and all that meat and dairy you eat. He's got udder form. He's got a little tail down here too. We could go through the doctrine of time tonight to talk about how addicting meat is. This is a study where they gave people meat to consume, and then they blocked their opiate receptors in their brain with a Narcan-like substance, which is what we use for people who go overdose. They come into emergency rooms, and we give them Narcan so they can breathe. Well, when they gave them the Narcan, they actually consumed less tuna and less cheese by 50%. Because when you eat this stuff, it actually releases opium in your brain. Not to mention the fact if it's cheese, it's metabolized in your body and you get opiates that way. Starches and complex carbohydrates did not have this effect. You can also go through the same data for sugar if we had time. So if you want to avoid your carcinogens and your insecticides and all your chemicals, eat plants. Here's the hot dog vendor and the cyanide vendor asking the guy if he wants to go slow or fast. This is the exposure of dioxin in your. So myself as a vegan, I'm getting about 3% of the exposure I would get on a standard American diet. Beef is the leading source, dairy second, milk is cheese and stuff. Chicken, pork, fish, eggs. There's some in the air, got to breathe, can't get away from that. A little incidental soil ingestion, you don't quite get all the dirt off your potatoes and your carrots and stuff like that. In addition, arsenic has been linked with cancer, coronary artery disease, high blood pressure, and diabetes. Leading sources arsenic in your diet is chicken. Where does the chicken get the arsenic? The federal government has approved over 250 arsenic-containing compounds to spray in chicken houses to increase their growth load and decrease their parasites. It's crazier than that. 2 of those substances have actually been shown to be approved as a coloring agent for plucked chicken carcasses. It makes them pinker. So you know things are really messed up when your government is approving arsenic-containing compounds for your food supply so they color the chicken carcasses. Pesticides have been associated with cancer. Leading sources are meat, dairy, and fish. Nitrosamines, leading sources of processed meats, bacon, and hot dogs. Heterocyclic amines are associated with cancer, and that's grilling of meats, not vegetables. There's a high chance that you will get, if you eat a standard American diet, what's called a little intestinal flu every year. It's foodborne illness. It's pretty significant, common, results in about almost 1 in 1,000 chance of being hospitalized, 1 in 55,000 chance of dying. We lose 5,000 people in this country annually because of food poisoning. Sources, animal products and contaminated plants from animal manure. All those bad things live in animal intestines. That's where they are. So here's a guy ordering bird flu, bird flu. You want the veggie burger or are you feeling lucky? I think I'll go with the veggie burger. So the prescription. Whole food, plant-based diet. Vitamin B12 supplements important. Exercise is important. Here's Dr. Barnard. You know you've made an impact on society when you make it in the cartoons. Welcome to Sweeney's All-You-Can-Eat Barbecue. I'm Dr. Neil Barnard. I'll be your waiter and your cardiologist tonight. Here's the ad libitum diet. That's the only diet that works. It's eating when you're hungry. They took 22 adults for 21 days. This is a Hawaiian study. Standard American diet, put them on a study diet, which was traditional, a lot of sweet potatoes and complex carbohydrate diet in Hawaii. They actually ate two when they were no longer hungry, and their calories went down almost just about 1,000 a day. But they weren't hungry. They ate when they were hungry. They lost 22 pounds. Their blood pressures were down. Their cholesterols were down. Their triglycerides were down. Their fasting sugars were down. That's what the ad libitum, the right diet, can do. And you get a lot of phytochemicals in plants, which are great, but you don't have to know about all the phytochemicals. All you got to do is know, eat a variety. A recent study showed that you're better off eating a variety of vegetables than if you eat a lot of one vegetable. So it's variety. Mix in the colors. Fitness is important. We've got to get off our sofas. But fitness is not just aerobics. It's aerobics, strength, flexibility, balance, and stability. If you are aerobically fit, you will have less fatal heart attacks, but you will have the same number of heart attacks. That's what the studies show. Meditation can be helpful. It does decrease the heart rate and the blood pressure, but it does interfere with the nitrous oxide system a little bit. The best supplement, it's not the beta-carotene. We did a nurses study. We found that people that had higher beta-carotenes had less lung cancer, so we figured we'd do a study and give people beta-carotenes. We had to stop the study. The people we were giving an isolated nutrient to had a higher rate of lung cancer. And it's been shown that supplemental vitamin A and E actually increase morbidity and mortality. So it's not just isolated supplements, it's the carrots. It's the whole foods that are important. Vitamin B12 is important. It's made by bacteria. It's stored in animal products. Recommend about 2,000 or 2,500 micrograms a week or 100 micrograms every day. And you won't have to worry about it. If you've been going from a standard American diet to a plant-based diet, you've probably got about 1 or 2 years stored in your body. But you don't want to mess around with it because some of the side effects are pretty bad and they can be non-reversible. Just to touch on vitamin D briefly, because it's hot. Vitamin D, now we like to see below 30, but some people are normally in their 20s. So going and get a vitamin D level, you've got to be a little careful because they're going to liable to push vitamin D on you, and vitamin D can be toxic. If you're worried about your vitamin D, just get some more sun exposure. At this latitude, which is where we are here, it's not hard to do, 15 or 30 minutes of sun a day. Just to touch on the protein myth briefly, there's no way you can eat adequate calories and not get enough protein. Your mother's milk has 5% protein, carrots has 10%, spinach has 50%. If you look at the essential amino acid profile of eggs, the essential amino acids, the ones you need, the essential amino acid profile of eggs is almost identical to broccoli and asparagus. It's not a more quality protein. It's all myth. Now, if we go beyond health real quick and you start eating plant-based, you're going to help the community's health, the nation's health, and global health. Land usage, 70% of the agricultural land on the planet is being used to support meat and dairy production. It's the biggest source of land degradation. There is no laws regulating the concentrated animal feed operation sewage production. In North Carolina, they make 2.5 tons of pig poop per person in the state of North Carolina. None of it is cleaned up. There's a big dead zone in the Chesapeake Bay based on the chicken industry there. The chicken manufacturers like Purdue own everything about the chicken production except the manure. For some reason, they let the farmers keep that. We can feed more of the world, 13 pounds of grain to make 1 pound of beef. 6 pounds of grain, 1 pound of pork, 3 pounds for 1 pound of chicken. It takes 78 fossil fuel calories to make 1 calorie of protein in beef and only 2 for soy. Water usage is off the chart as far as animals are concerned. We can reduce the suffering of billions of animals who die horrific deaths, and not to mention the workers that work in these industries. You want to take a ton of carbon out of the environment? Drive a Prius. You want to take a ton and a half out? Go vegan. 23% of the greenhouse gas effect in the U.S. is from the meat and dairy industry. So you can avoid many diseases. We didn't touch on them. If Dixie's nice enough to have me come back next time, maybe I'll hit cancer and the autoimmune disorders and osteoporosis and some of the other ones. But you start finding there's little nuances as to why things work in each of these areas. You have to trigger it. But the base thing you need to do is you can go on a low-fat, vegan, plant-based, whole food diet with vitamin B12 supplementation. So my purpose has been to at least get you to think about change your behavior, or at least help you change other people's behavior. It's not going to be as hard as you imagine, and it's going to be a very rewarding journey. But the medical professions can use your help. Back in the late 1800s, the doctors were just craftsmen. They'd solve your problem, limited inventory. Then we got to the Ford assembly line, where management solves problems and people are just working on the front line. Most of medicine today, the doctors are still working like craftsmen, and the management at the top of these medical organizations like Kaiser and Sutter and Mercy are making the decisions and treating people like Ford assembly line workers. We got into quality improvement. This is when made in Japan meant junk, for those of you who remember in the 50s, and now it doesn't mean junk anymore. They used frontline involvement and team solving problems. We've gone a little bit farther now, and for right now, healthcare is somewhere between mountain climbing and bungee jumping in safety. We do have a very safe specialty. It's anesthesiology. We do a great job in anesthesiology in this country. If they put you to sleep, you're probably going to be woken up and you're not going to have any complications. They're as safe as the regulated industries. They're almost as safe as the scheduled airlines and nuclear power. But healthcare is somewhere down here between we're getting about a B, basically. Now, so I want you to go back and help change the medical profession. I want you to talk to your doctors. I want you to be kind, though. They've got a lot of articles. They can't keep up with all this stuff. Michael Greger reads up to 12,000 articles a year just on human nutrition. Medical doctors like myself would have to read 35 to 40 a week just on the medication end of the business, not even talking about the nutrition. Many of these doctors are trapped in poor models of management and medical organization, defending a craft system, and the third leading cause of death. They're overworked and they're not prepared or trained for this. But if you go into your doctor, here's a patient saying, I can't tell you how glad I am to have finally found a doctor who doesn't harp at me about my weight. Fat doctor. It's been shown, I tell this to my doctors, that if they practice what they preach, they will get better compliance with their patients and they have more credibility. So go to your doctors, share your stories, tell your stories, demonstrate your improved markers, but be clear you don't want medications first unless they can actually prove it to you, and also that you would prefer to cure your disorders instead of control them. So if we don't do that, we're going to help move behind a high-activity system that's ineffective and expensive. And when you go out in the world, you're going to be confronted with people who aren't plant-based. A lot of these people have never even, 58% of people haven't even heard of the term plant-based diet. Even just introducing them to the concept is a step in the right direction. But you've got to be careful not to stick to your behavior and lead by example, but come across kind of soft, don't take status away from. They offer you something, say, yeah, it looks really good, but I'm on a health kick now, Just take it easy. So, key points, closing. Chronic diseases can be prevented. Chronic diseases can often be cured. Early is better, never too late. And in closing, we've got to start eating off a different parking lot. I brought some PCRM handouts that they sent me, which is the best 16-page introduction to plant-based. And if you have friends, you can have them go, and it's free online at the PCRM website. You can go to my website. There's some video clips on 5 patients that went through Meals for Health. You can also see a clip on Ben. email me with any questions you have. I'm always glad to get emails from people. And my card's in the back. You can pick one of those up. Go to my website. And I just have a lot of people to thank. And you can see Neil and John and Michael Greger and Jeff Novick, Caldwell and Dan Ferraro for his cartoons. And, of course, Dixie for having me. So I'll stick around for long questions. Thank you very much.